to the contrary, what would you say some of the upsides are of urgent care?
The upsides of urgent care, I would say, is the fact that we can do things where you don't have to wait to see your primary doctor. So one of the good things about things like the Affordable Care Act is that it introduced a lot of new people into the health field, right? Into health insurance, et cetera. Bringing them into healthcare was phenomenal. The bad thing about the Affordable Care Act is that it introduced a lot of new people into the
system. Yeah.
the system, right? Well, what we did not do is have any way to train immediately nurse practitioners, PAs, and physicians to take on those new patients when it comes to primary care. And so the wait times for primary care became very, very, very long. And I'm sorry, if anyone's ever had a urinary tract infection, you don't want to wait 2.5 weeks to see your primary doctor.
No.
Right.
And it's not the ideal thing to have your primary doctor call in an antibiotic because we need to get urine culture.
Yeah,
It's another
definitely.
thing. I want to talk to my audience and tell them, listen, if you have symptoms of a UTI, go to the urgent care. You don't have to wait the amount of time that you would have to wait with your primary care. It's not appropriate to go to the ER with a UTI, okay? It's way too involved. But we need to take a urine culture. Why do we need to take a urine culture? Because some bacteria are resistant to antibiotics. We won't know that.
Mm-hmm.
What's going to happen is if you call that telehealth number and you get that prescription, and then you're going to continue to have symptoms, and then now you've got antibiotics on board, so they could mess up the culture if you decide to go in the future. So for urinary tract infections, perfect. Go to the urgent care.
Such a
Rob,
good
what are the
point.
symptoms, though, of urinary tract infection, since we're talking about it?
Great question. So symptoms of urinary tract infection, you can have urine frequency, meaning you find yourself having to go all the time. Like I just went 10 minutes ago. Why do I have to go again? Burning when you urinate, just, a little bit of a burning sensation when you start to urinate. You can have something called hesitancy. Hesitancy is when you say, okay, I feel like I have to go, and then you get there and then nothing happens. So frequency, burning, hesitancy, those are all the big symptoms that we can see in the urinary tract infection. And if you have those symptoms with like lower back pain,
Yes.
well, that's a problem because that means that the infection is probably gone from the bladder up to the kidney. And so now that's a different story because if you get something like that, the next step is urosepsis, and now you've earned yourself a trip into the hospital and possibly a visit to go see Dr. Rutland in the ICU.
Yeah, maybe.
How you get there?
Yeah. Yeah.
If it gets bad enough, urosepsis is a real thing, and it can definitely, lead to hospitalization.
So we've talked about ups and downs. Are you seeing burnout at all in the urgent care? We know we see it in the hospital. We see it with nurses.
How many patients do you see a day when you're answering this question?
Yeah.
That's,
I'm laughing to keep from crying. Okay.
Yeah.
So
We feel you.
yeah.
yes, burnout definitely happens. And now it's a great question from that perspective. I'll give you some personal examples. During the pandemic, maybe we have 3 providers and we would see 200 plus patients a day.
3 providers for
3
200
providers.
patients.
Yes. We were frequently worked like that during the pandemic to the point where there was a lot of burnout on the part of nurses and physicians, specifically in the urgent care, because we were just overburdened because the primary offices had closed.
Right.
And then if you look into the ER, you weren't sick enough to go to the ER.
Yep. We were
So-
sending patients right out
Right.
of the ER.
It's like,
Yeah,
you're not sick.
couldn't-
You're
yeah.
alive. You got to go out.
Yep.
Like this is for patients whose oxygen saturation are 88%, et cetera. So where did they go? They all went to the urgent care. So you're talking about weeks after weeks after weeks, which turned into months of seeing that volume of patients.